since we started this HIHA award, we have seen increased interest from the public. We have seen more enthusiasm from the institutions that want to participate in HIHA award. And because of that, we have witnessed very, very huge numbers of nominations. And this is very good, because that means that the population each year gets to know more about HIHA awards.
So this Heroes in Health Awards has really given me that credibility and visibility, and because of that I've been able to engage with several collaborators and stakeholders in the pharmaceutical sector. When I went back to Mbarara University of Science and Technology after getting this award, I was granted a very prestigious seed grant by the Center for Innovation Technology Transfer to push this project ahead. This has also given me the ability to advocate for pharmaceutical innovation in my profession. These days when I speak, at least someone has confidence in me, because I've really done something that everyone has seen that yes, this gentleman and his team has been able to come up with something.
So one thing I would say is I want to take this opportunity to thank HIHA Awards because it has had a very it has been instrumental in my path to leadership. It has also helped us to gain visibility and credibility. So thank you so much for giving us a chance to showcase our projects, to showcase the kind of work that we do. And it has been a personal journey for us, because we have not only formed professional partnerships, but we have also formed professional relationships that have gone on to become mentors. These are some of the people that are mentoring us currently, not only in Uganda. These are people that have connected us to other sources of income. These are people that have connected us to other opportunities for us to be able to bring this, this project to life.
Frankly, I didn't know about HIHA. We could hear, I mean, like all initiatives which come. We had Heroes in Health Awards, and at that time we didn't know how it works, who does it. But when we were invited and we were asked that we had been nominated for the HIHA Awards in 2000, then we started questioning ourselves and saying, what is HIHA? That's when we understood that it's an effort to recognize health workers, institutions that make a difference in terms of supporting the healthcare systems in our country.
Require our support as we build a stronger system. As you know, healthcare systems all over the world have faced evolving challenges. So it was critical for us to refine and redefine these approaches in order to stay relevant and effective. So our vision was these awards would fill a critical gap in providing non-monetary mechanisms as we continue to appreciate the outstanding contributions of our healthcare workers.
So when the HIHA Awards were introduced, I think about 5 years ago, along that way we got to learn about the work that is being set up around HIHA Awards, particularly focusing on recognition of people that have really excelled in the health sector. As you heard, our programs are wide, and so we felt that everything that sort of focuses on recognition of exemplary pieces of work, innovations, was really something that's very core to what we do and what we stand for. So we were very interested in participating, and we've been participating. We are happy that it wasn't a one-time event, but it's something that's going on, because each and every year there are new groups of people that need to be recognized.
So Living Goods became involved with HIHA Awards, I think about 3 years ago, and our initial involvement came about when we recognized that one of the cadres in the healthcare system had been left out of these awards, and that cadre is the community health worker, commonly known as VHTs or village health teams in this country. They are a critical cadre. They are what we refer to as the Health Center 1. They are promoting health services right in the communities. It's the only health cadre that gets into our homes. to promote health, to educate. So when we noticed that that cadre had initially been left out of the awards, we took it upon ourselves as champions for community health to ensure that they are not left behind. And happy to report that for the last 3 years, VHTs or community health workers have been part of the cadres that has been recognized at the HIHA Awards.
WHO was involved from the start, from the inception of HIHA. Following the measles outbreak and the campaign, we observed that it's not only financial rewards, but also appreciation which motivates health workers. And we thought with the HIHA organization, we thought that it would be appropriate for an award to be set up for appreciation of health workers. And it is within that time that we also saw that how much the public was appreciating the extraordinary effort the ordinary health workers are doing by sharing the hardship they were encountering and defeating, that we realized that the public really appreciates health workers, and HIHA would have been a good forum to express that appreciation in the form of an award.
The HIHA Awards, my involvement began with a shared mission or goal with the HIHA Awards, and which was about celebrating the unsung heroes in the health sector. These are individuals who are doing a great job amidst challenges to ensure that the population is leading healthier lives. So that HIHA gave us the opportunity to align with PSI's mission of ensuring that people are leading healthier lives.
Now when the HIHA award came, actually I was even surprised. I had just got an award, actually it was in October. I just come from the US, I just got an award, the Global Partnership Award. Because as I said, I've been working a lot with these IPs and what. And then when I came back, I got a call from the Ministry of Health, and they said, you have to come, you are going to get an award. I said, okay. And I was somehow shocked. Sometimes you are doing things you don't know that people are watching. It's like I said, now who knows me too? Because they said, almost 100,000 people voted you. I said, 100,000? I was so humbled. So now, HIHA, now this Heroes Award, what it has changed is that, sometimes people can talk about it and say, oh, Dr. Nakaketo is doing this, Dr. But when an award comes in, then it is real. It's not like maybe somebody is talking about you because they know you or you have treated their baby or what. But if it becomes an award now, it means that you have really, the work is visible and it is progressive. So that's the difference it has made, because the award, they have known it in the US, they have known it where, because it's so sad to get an award globally and yet back home there's no one recognizing you. So I was happy that the two came in together, although the other one was first, but they were almost the same time. And then I said, okay, even at home they have recognized me, so the other one is not fake also. So I was really happy that visibility became of the work, and you also feel good and put in even more effort because you know that you are making an impact. And that's why I thought that this initiative was a good idea.
So ever since I got the Heroes in Health award for the Midwife of the Year in 2021, I can testify that lots of positive things or achievements have happened. And I'm going to start with this. First of all, most of the people actually came up to me, and the nurses and midwives were requesting me to be their mentor. So I became like an inspirational, I became like a great icon, and people were looking up to me. So they asked me if I could be their mentor. So I've gotten mentorship opportunities. I've also been able to get, the networking and collaboration opportunities, various organizations, especially those that deal with, are into nursing and midwifery, those that are into maternal, newborn, child, and adolescent health have also approached me, and they have availed various opportunities for me.
You just have no idea when people are identified and they are awarded. We may not give monetary term, in terms of money, we are not able to give the money, but it makes a lot of difference. It fosters confidence in our work. These partnerships also have brought more people to participate, because at first we started with few entities, but now we see more people, more institutions getting involved. We have seen also that especially the individuals that are awarded gain that visibility, but also get opportunities to get better, to be promoted, to go for further studies. So these partnerships have not just stopped at giving people awards, but it has also created a team, a cohort of people who are like-minded, kind of approach, or those who think alike, because we do believe that one way to motivate our workers is to award them or to recognize them, or one way to improve on the performance of the institutions is to recognize their efforts, their inputs, their commitment. And so this partnership, I must say, that has brought us more people. It has increased the entities that are participating. It has brought us together to commit to excellence, because through these awards, people go back and start committing to see that they want to improve whatever they are doing. They want to see that they get better and better. And so we are seeing more energy, we are seeing more commitment to the institutions that participated, but also the ones that are yet to come on board, because they also want to be recognized. And it brings visibility. This partnership actually brings out the visibility of the best practice.
Stanbic's brand promise is Uganda is our home, we drive her growth. Because of this, we are players in various sectors, including the health sector. We consider the workers in the health sector as unsung heroes. A core of our organization is recognition, so we felt it right to partner with the Ministry of Health to recognize those health workers who, despite the tough conditions that many of us are aware of, still show up and give it and go the extra mile. Because of that, we felt it right to be a part of making a difference and letting health workers like that know that they are valued and the work that they are doing is truly the Lord's work.
We have seen a number of achievements come out of these Heroes in Health Awards. The past winners, some of them have gotten opportunity for scholarship, for grants, as a result of the visibility given to them by this important award, which has become a household name. So we hope that continued partnerships with our stakeholders, we will be able even to tackle the available challenges within the health sector. For instance, the question of health financing that is geared towards attaining universal health coverage. So the Heroes in Health Awards are an important tool to ensure that we realize the Ministry of Health mission and also its objectives.